This is one of the most important PPPs that we have initiated since our inception as a government in the area of health and also generally within the county. As has been indicated by the Chief Officer of Health and the in charge, the National Coordinator of Non-Communicable Diseases of the country, we have had impressive progress because to ensure that about 20% of a county population is being covered in an initiative, that is a commendable job. But the ideal is to ensure that at the minimum 600,000 people from our population of 1 million are covered, and that is therefore work in progress. In a meeting that we had, we pointed out that previously in traditional societies in our county and elsewhere in the country, non-communicable diseases were not a real factor because of the health patterns, the foods that people ate, the exercise that they did, the work that they did, and so on, that made high blood pressure and diabetes long time ago not a major factor. But with changing patterns and urbanization and so on, these two diseases have become a major factor even in rural areas. And unfortunately, because in the past they were not a major concern, it took some time for people to realize that there was a new genre of disease that had come into play. And that is why our work together is so significant because as we are trying to develop a model of ensuring that we reach rural areas and we reach urban areas in the county so that we can develop a robust model which will in time be replicable at the national level. And that is why we really treasure this PPP, because it will not only assist Makueni, and it is already assisting Makueni, but it will be replicable at the national level and at later, we hope, at the continental level. And that is why we also appreciate our work with the national government so that as a big brother or big sister, from the word go, they are involved in this initiative, this innovation, so that they continue to lay the foundation for replicating it at the national level. And of course, a lot of work in this area is being done at the national level. So this model will simply entrench what is happening at that level.
In Makueni, we have specifically been targeting hypertension and diabetes. We have been working on a model which we believe it will go far into revolutionizing the care given to our non-communicable diseases patients in this country. As the Chief Officer of Health has said, we have been able to screen quite a number of patients, over 122. Out of those, I think 14,000 have already been linked to care. And one of the very, very good things we have observed here is that out of those who have been linked into care, as he has indicated, the retention is very high. Not only the retention, but also the control rate of both diabetes and hypertension in those patients is very high. If you look at the control rate, which we are seeing here in Makueni vis-a-vis the national level, here it is about 6 to 7 times higher actually 7 times higher than the national level. And therefore, that tells you the model is working very well. Again, we are also piloting reporting of non-communicable diseases using the same diseases, hypertension and diabetes. We are able now to collect the data for those conditions like from the community level, leave alone the dispensary, kutoka kijijini mpaka national level, and relay that data electronically. And I think that is something wonderful we are experiencing here in Makueni. That is something we would love to see it go through the whole county and eventually the whole country. Because in this country we are having a lot of paucity or lack of data. And through the model which we are implementing here, we have no doubt we shall be able to achieve the desired result of reporting all our non-communicable diseases within this country timely and effectively for better planning of health services.
This program has been able to use community health volunteers who have been adequately trained through this partnership with Medtronic Lab, and they go into the communities to help us to do the screening, and these patients are referred to the health centers where our healthcare workers have also been trained on NCD management. And we also work very closely with the Ministry of Health, national government, in this partnership so that we make sure, in keeping with Article 43 of our Constitution, our NCD patients achieve the highest attainable quality of health. We've been able to have very high retention rates of our patients, more than 90%. Systolic blood pressure control has also been achieved, more than 10%. And so all these milestones that we have been able to achieve at this level, we want to scale to the entire county so that every citizen of Makueni who has high blood pressure or blood glucose that is high, we're able to manage them well. And I think it's the intention of this partnership that the country eventually benefits from this innovation and probably later on many other areas of the continent. So we thank our partners, both Medtronic and the National Ministry of Health, and His Excellency the Governor for the support that the Department of Health has received all through this journey.
Improve the patients and the lived experience for all of the people in our community who are suffering from hypertension and diabetes. And it takes technology, it takes medicines, and it takes a commitment to solve problems together to make it better for all of us. And this is just the beginning, the work that we're doing today in Makueni, and really look forward to learning and scaling the work that we're doing to not just the rest of Kenya, but beyond across the African continent too. And it's a joint effort, and I just want to say thank you to everyone.
The purpose behind it was to bring meaningful innovation to communities around the world that would have an impact. And we were happy today throughout the meetings to discover that impact is felt, and it's felt at a great deal. And as His Excellency has referred, this is a program that was born in Makueni, but it's actually something that is meaningful to the entire country and hopefully to the entire African continent. We see great results, and we as a company who always would promise and want to deliver better results for our patients, that fits that directly into our mission. And I'm grateful to the teams here, the medical directors and leaders of Makueni for making this happen, because a lot of other communities probably thought it was mission impossible. And yet, usually the people who believe in mission impossible and making it possible are the ones that bring the biggest change. And so we're forever grateful, and I'm sure the country will be. And we'll always be interested to explore more and to see how we can bring a complete solution just to ensure that the results for the patients are felt throughout their life, and that the qualities of these communities, the healthcare quality delivery system to these communities keep on improving. Thank you very much again, and I appreciate the efforts from everyone who contributed to this success story.
You know, I've been personally involved in this program from its very inception. as long as 7, 8, 9 years ago in the thought process. And it is a real delight to see it being actually implemented here in real terms with measurable results for the first time anywhere in the whole world. So I just want to thank everyone for doing that. But I also want to close by saying in clear terms that this is the start of our journey together, and we have a long way to go, and we can really move the needle in healthcare. Thank you all very much.
And we have rolled from the hospitals and now to 11 health centers and also to the communities around those health facilities. And we are seeing a great change in the management of non-communicable diseases. And Your Excellency and our partners, we will be able to continue supporting this program as a department, and I'm certain that we'll be able to replicate it in more health facilities, reach out to more members of our community, and as expressed, target the entire adult population of approximately 600,000 for the county. Currently, we are at around 20% coverage. That is 122,000. Thank you all. May God bless you.